Okay, this is Jessica Pickett. Since we don't have a quorum, we're just going to do a informal meeting and cover all the items we need that we have on the agenda for the community services meeting. We will not do a call to order or approve the agenda or approve the minutes from the previous meetings, so we'll save that for the next one. First on the agenda was Palace Transit contracts. We will have to wait till we have a quorum to approve those contracts. So we'll start with item number 2, COVID transportation update. So I just want to let you all know that we have trained with Avera. They had their trainer train a bus operator and myself on how to properly don and doff PPE, personal protective equipment. So don and doff means put on and take off the protective equipment properly. Along with that, they provided us with some supplies. The state of South Dakota Department of Health provided us with some supplies for PPE. We put together a sheet that explains how to put everything on and what we need to be doing if we are going to be doing non-ambulatory COVID transportation. So that's wheelchair COVID transportation. Yeah. We put together that sheet, and that driver and myself are training the rest of our staff, the other drivers, on how to properly don and doff the PPE if they're going to be doing non-ambulatory transportation. And we are going through our staff. There's just a few more left to train. We put together these kits, their bags to fill and refill, and we've actually been providing quite a bit of COVID transportation. Most of them are ambulatory. I think we've only had a couple non-ambulatory. They are to go to the hospital for infusions. They go to dialysis. They go to the regular doctor appointments if they are having complications from the COVID and they aren't able to get to the doctor to see what that doctor can do for maybe breathing treatments or that kind of stuff. So we are providing that transportation.
That's awesome.
It was difficult at first because we had people trying to schedule same-day rides, which is fine to schedule same-day rides for COVID. However, they were scheduling them during our busiest times of the day. And to do this kind of transportation, it requires a driver time to go get the bus, because it has to be a separate bus, to go get that person, don the PPE, put that person on the bus, bring them to their location. Well, they have to doff the PPE, then drive to that location, don and doff the PPE again, and then drive the bus back to the bus garage to be disinfected properly. And that just wasn't possible with our schedule and our lack of drivers. We're short on drivers to do that with such short notice, especially during our busy times. So working with Avera, and we're trying to work with Mitchell Clinic and as well, we need the medical providers themselves, the hospital, to call us, preferably the day before so we can put it in the schedule, but we understand if it can't, and let us know that they have a patient, this is the time, will this appointment time work? So that way they can schedule the appointment with us first to make sure it'll work, and then that patient can work on seeing if that will work for them. But primary, if they want to be able to get there, they have to do it within our time constraints as well.
Yeah.
But Avera's been very good on working with us on that, getting these things scheduled properly. And it's, like I said, it's been a process. It wasn't great at first, but I think we're getting there.
Okay.
And it's nice that we're able to provide this, because otherwise these people would have no way to get to where they need to go for these treatments they need. And it's also helping on the healthcare system as well, because people are then getting these infusions or meeting with a doctor instead of getting admitted to the hospital and taking an ambulance.
Thanks so much for your efforts in that area.
Yeah.
Absolutely. And other transits across South Dakota are also providing COVID transportation. They're just not taking all the steps that we're taking for our drivers, training them how to have proper PPE. They don't have the proper PPE, and they're not secluded from other passengers always either. So I think we're doing it at a safer rate for our community than
Thank you.
what others are doing. However, we did email the sheet that Avera and I developed on how to apply the PPE, I did email that out to the rest of the transits in the state so they had the information that we had.
Thank you.
Thank you.
Any other questions on that? Okay, we will move on to the adult nutrition snowflakes. I'll let Amy give that update.
So on our snowflakes, our original goal was 93 names, which is a 20 meal ticket per one, $80 a ticket. So our goal was $7,440. Currently, we're at 13,372. I do know of a couple more donations that are going to still be coming in, so we will be able to give out more tickets to those in need.
Oh, thank you.
Our community really came through. It was great seeing them all come in.
And actually, the story was after Christmas.
Yes.
And that, you know, that was awesome. It
Yep.
worked out just fine.
Yep.
Good. Glad to hear it.
Any other questions on that? I think it was something successful. I think we might try that again next year doing the snowflakes versus the tree.
Yeah, that was good.
It allows them to come to the drive-through. You get more of the community. Some of those don't want to take the time to come into the building.
Yep.
Why couldn't you do both?
We probably could do both too.
Mm-hmm.
For the ones that do come in and then the ones that only go through drive-through?
Yep, we could probably even do that. Okay. Next on the list is nutrition serving supplies. Just to let you know, we are no longer getting additional funding from the state for our nutrition program. They cut that quite a while ago. We were serving with disposable items. Since we do not receive the funding and the state wants us to provide congregate meals, they want us back to eating congregately but spaced distantly. They said we should be going back to our regular serving supplies. So we have transitioned, starting at the beginning of the year, at all of our locations to the regular serving, the trays, the regular silverware, that kind of stuff, and they're being washed. We did not do it at Green Ridge or Meadowlawn because our meal counts are so low there, and we do not have site coordinators at those locations to serve the meals because they average 8 meals at most a day.
Yeah, one is 5 meals and one's probably about 7 meals
Yeah.
average.
Okay.
So that's why it wasn't, otherwise we'd have to pay for a site coordinator and that, so we do the to-go supplies at those locations. Otherwise, we are serving congregately.
Well, we do still get a lot of takeouts at JVCC, which we use the to-go, but
Yep.
Is there any way we can get the salt and pepper back?
No.
well, you get the little
You get the packets.
Yeah.
We just don't want everybody touching the same
Yeah,
thing.
we don't need everybody touching the same item, that's
Right.
why.
So they have the packet.
They have
Yeah.
packets.
Yeah.
So you got salt, Louise.
Yeah. One packet per person.
No,
No.
you can have more if you want
You can do
more.
more. We have them sitting there.
Take
Yeah.
10.
Just tell Allie you need more salt.
Yeah.
And
Yeah,
we're
I
not
like
doing,
pepper
about
though.
that.
we are not doing coffee though.
Yeah, we are not doing coffee, that's correct.
That's
Yeah,
fine.
But
That's
they,
good.
if I remember right, they can bring their own coffee.
Yes,
Yes.
they can bring their own.
Yeah, salt's not good for you.
Has going back to the congregate
Yeah.
impacted the numbers?
No, everything's about the same still.
Okay.
We still get a decent amount going through the drive-through, which is totally fine.
Yep.
We have one site where their commons room is not open yet, so they're now taking the trays to their room. But we haven't had no issues with that either, so.
Any other questions on that? Okay, item number 5, the JVCC tablets. So we have the tablets all up and operating for the James Valley Community Center to be checked out. The only thing is we're waiting for the cases to arrive. So as soon as we get the cases, what we will have is their Acer tablets, and they'll be available for our members to check out and use while they're at the JVCC. They're not allowed to leave the building,
Oh,
but
good.
Maria will have classes, and just if you want to come into the building, use the Wi-Fi and use a tablet, we'll have that available at our facility now.
So how do they sanitize those in between people?
Very good.
We have ISIL whatever
Okay.
wipes, the sanitizing wipes that are provided. So we'll sanitize each item
Is,
afterwards. And,
A tablet's about the worst thing.
oh yeah, it's just like a
You're
phone.
touching all over it.
We have 11.
Oh, really?
Yeah.
Where did they come from?
They are the old transit tablets that were in the buses that the transit used
Oh.
to dispatch their routes and stuff.
Okay,
And those all got updated with the new push to talk.
okay.
So we had these old tablets sitting around doing nothing.
Oh.
So I thought, why not just use them for
Yeah,
the community
Great
center?
idea.
that's great.
So does Maria keep all of them?
Maria will be keeping all of them, yes.
And when you come in and you want one, then where do you go with it?
Anywhere in the building, you just connect to the Wi-Fi.
Okay.
Just can't leave the building with it.
That's good.
Understandable.
Mhm.
Any questions?
No, making good use of it.
Yeah, it's nice to not let them just
Yeah.
sit there and not being used.
That's a great idea. Good job.
Next on the agenda is the COVID operations plan. We can't really do anything about that without a quorum, but it has been running just fine the way it's been. We had no issues.
And we shouldn't change it now anyway.
I think it's going good. Citizens input, there's nobody in the building. You guys have anything you want to say?
Nope.
Item number 8 is department updates and reports. So Palace Transit, the ridership was in the packet. Our ridership is actually doing fairly well considering we're still dealing with the pandemic. Last year, of course, 2019, we did not have the pandemic going on in December 2019. Our elderly riders are down and our handicap riders are down and our general public. But our school age and our Head Start and general public, I think for the most part, is staying pretty good. For the most part. Any questions on the ridership?
No.
Nope.
Then we have the Mitchell Volunteer Program update. Amy, you want to say anything about it?
Not much change from last time. Not much going on with all the COVID.
Yeah, there's not much with the COVID, unfortunately. The adult nutrition, I'll let Amy talk about that.
So the December nutrition, for December, we were down 718 meals to our projection. And so far for this fiscal year, which started in June, we're down 3,142 meals.
And that's just to projection.
That's to projection, yes.
Mhm.
I mean, we're down a little, we're still down from last year, but hopefully.
Unfortunately, we did have quite a few participants in all of our locations pass.
Yes, we have a lot.
I know.
So we're getting new participants, but we had a bunch of daily eaters and it's sad. And then we have the adult nutrition, or the James Valley Community Center report. Maria put that together. Talked about the line dancing. The cards have been slow. but we have quite a group coming in playing pool. I guess the quilt raffle is today, and Maria's going to do a Facebook Live on the quilt raffle.
Yeah.
If you want to watch that. Do you have any questions on Maria's report? New membership cards have been going out.
I didn't have any questions.
I was concerned that because, you know, there's not a lot going on, that our membership would not, you know, that they wouldn't reapply, but apparently most of them are doing that.
They are.
Especially, yeah.
People like that newsletter. I think that's our biggest draw. They like that newsletter, and
Yeah,
I think Maria's doing a good job with the new way we do the newsletter.
yeah, very good. So that's not going out to a printer anymore.
Nope, we're doing it all in-house now.
Good. Yeah. I
I
always,
thought it was good how the card games is apparently bringing in more of a generational. She noted the intergenerational.
Yeah, it was fun
Yeah.
seeing a younger couple playing and learning,
Yeah.
and
yep,
I know it's a hard habit for me to break, not refer to it as a senior citizen center. So that takes time, you know, but that's exciting to see that it's expanding.
yeah.
if we all keep saying JVCC instead,
Yep, I always say community center.
community center, yes, and not senior, that helps.
Oh, do we have any other questions? If not, I am going to wrap it up.
When's our February meeting?
February 11th?
February 11th is the next meeting.
Okay.
Thank you.
Thanks, everyone. I appreciate it.
Good to see you,
Yeah,
Bonnie.
thank you for the information.
Absolutely.
Thank you.
Take care, everyone.